Every year, there are 1.3 million to 4 million estimated cases of cholera and 21,000 to 143,000 deaths worldwide. But in recent days, no fewer than 15 people have been reportedly killed in a cholera outbreak in Magboro, Obafemi Ode Local Council of Ogun State, a border town to Lagos. With this, the death toll from the cholera outbreak in Nigeria since January stands at more than 2,000, with more than 65,000 suspected cases, according to the Nigerian Center for Disease Control. 76 fatalities were reported in 25 local government areas across Borno, Adamawa, and Yobe states over the last 2 months. Bauchi State with 855 cases, Katsina with 396, and Kano's 306 cases accounted for 73.2% of the 2,127 suspected cases. The others were Yobe with 162, Zamfara 80, Niger 78, Borno 67, and Sokoto 45, among others, with children aged between 5 and 14 years as the most affected age group for both male and female. Joining us now to take a look at the development is a medical expert who is a public health physician, the Chief Executive Officer of Medway Health Limited, Dr. Tuyi Mebawondu. Doctor, you're welcome to the studio.
Good morning. Nice to see you.
Thank you very much.
Good morning. It's good to have you in the studio.
Thank you.
I mean, Doctor, we thought that in 2018, when we had this, massive bout of cholera, we thought that, 3 years after, we won't have to be dealing with all this because we know that it is seasonal. Every time that there's rain, etc., we normally will be prepared. But look at what has happened this year. More states are involved. More people have died. More victims here and there. Were we ill-prepared for this, or what's going on? We shouldn't have to be dealing with camera at this point in this manner. What are your thoughts, please?
We shouldn't actually, you capture it appropriately. We shouldn't be dealing with cholera at this stage of existence. Cholera is a disease of poverty, disease of underdevelopment,
right,
bad governance, literacy, driven by two main things: inequality and malnutrition.
Yes.
Now, you can see the frame. Cholera came into Nigeria first, 1972, when we had the first pandemic brought from people that traveled. And then between 1972 and 1991, we were good. In 1991, 2000, 2014, 2018, were sequentially. Now, cholera has become an annual event in Nigeria. Initially, it used to be like World Cup every 4 years. Now, it's an annual, if I be sure that every time Nigeria will have cholera, then why are we having cholera? Because it's a preventable disease.
It is.
It's treatable disease.
Yeah.
Simple thing that has to do with quality of governance, quality of understanding of sanitation, water, and hygiene. You have a country, 50 million people, that's 10 million households are practicing open defecation.
Yes.
We're number 1 in the world. They poo everywhere. Out of the 774 local governments in the nation, we have just only 14 that is free from open defecation.
Only 14?
Only 14 out of the 774 local government. These are actually things that has to do with the level of local government. Somebody will be able to be
That's right.
addressed to water, sanitation, and hygiene. As much as 167 million people in this nation do not have access to hand washing technique.
Right.
So you see that water, just 90% of us have access to good water. Contamination underground, contamination on the surface. Lagos is a typical example. Nigeria, a lot of states in Nigeria are named after water.
Yes.
This water, that water, so river, this river, or whatever. And at the end of the day, water everywhere.
Water everywhere, but little to drink.
None to drink. So why then with no sanitation, no hygiene, why then do you think that we won't have cholera every now and then?
So what do you think at the state and local level, the government at the state and local government can do to make sure that you just raised the issue of open defecation, which is one of the biggest problems, because during the rainy season, we see like the feces flow through. But also what is interesting is the fact that the president of the Nigerian Medical Association, Professor Innocent Uja, has said that no state in Nigeria, including Abuja, has 24-hour running water. It's not possible. I mean, how possible is that? And how important is that?
Extremely important, because you see, you have to measure the development of a country based on these basic things. How will we, to 2021, we can't have water to drink? You'll be surprised. What is the problem that we cannot just have water? We cannot, but for me, I'm not trying to push things to states and government again. It's a tired repeat. Government do this.
But is there responsibility?
Yeah, it is. But again, individual.
Okay.
Please embrace sanitation and hygiene, personal hygiene, food hygiene, environmental hygiene. You have to actually focus on those three things at the individual level. We don't have water to drink, and then whenever the rain falls, all the waste on the surface now contaminates the water you're going to drink. Okay? So now, we expect a local government to hang around and ensure that drainage, sanitation, the water supply. Now, we're not taking the requisite investment. We're not pushing the requisite investment in water supply for the people. I can tell you for free that 20 minutes boat ride from Ikoyi down to Ekweside, you will see that people dwelling in the rural communities are drinking the water they are defecating on.
Correct.
So it's an embarrassment. We shouldn't be saying this. And then when you now talk, people figure that, government cannot do everything. If government cannot provide water, cannot help in sanitation, cannot provide roads, what is the purpose of governance?
So, but how do you even tackle the issue of open defecation? People are doing this because there are no toilets. Accessible toilets.
Indeed.
And you're saying that there's nothing the government, they can do that. They can install toilets. They can, have that environment, that enabling environment to desist from
It's a problem that
open defecation.
we've been looking up to them to do something. That's why I'm throwing out for us.
Right.
Since they're not doing anything, we're going to allow ourselves to that. But the key thing is that look at the local government, for instance. What you need to do is...
Well, I want you to hold your fire.
Okay.
Well, I'll just want to take a video. Well, during the week, a cross-section of residents in Banzango area of Nigeria's capital, Abuja, asked the federal government to provide public conveniences to curb open defecation and reduce spreading of cholera in the area. Arise correspondent Chinaza Samuel reports.
There are several communities, settlements, and villages that lie around civilization, yet lack basic amenities and infrastructure to reflect national development. The Bazango community in the Buari Area Council of the nation's capital Abuja is one of such places. Bazango is merely 30 minutes away from the nation's city center, yet access to waste generation and disposal is considered a luxury here. The absence of toilet have made open defecation a common phenomenon. Little wonder the area is said to be most affected by the cholera outbreak in the FCT.
We are not using the soakaway toilet. We are using the indirect toilet. So if the government will help us and bring the soakaway toilet so that we'll begin to use it. Because Bazango here, poor people are here, plenty poor people. We don't have money to do that the international toilet.
What we expect for the government, we expect, for example, now we expect good toilet and good. This is some of us say now we don't have this water tap, so we expect like borehole and a good toilet for us to be using.
While Nigeria now records over 1,000 deaths and an increasing number of cholera cases, some residents of Bazango community say the level of awareness about the epidemic is low.
The system of identification in this community is quite poor, and the only people that will help us to take care of this issue is the environmental health. If only they can do their work as it's supposed to be, that they will be coming almost every week or twice in a week to check around and put them and make them to notice that they don't know about cholera. If they explain to them, I know they will take corrections. By the grace of God, I know they will take corrections. It's only because they don't know anything about it. They have been They have been ignorant about it, even if they tell them, but they need more education about it.
The federal government has now flagged off an environmental sanitation campaign here. This is part of a program to sensitize communities and put in place environmental health surveillance for hotspot communities. Residents here are very delighted. They appeal for the provision of a better public sanitation system.
I would like to inform you that with this flag-off exercise of the elevated National Environmental Sanitation Intervention Response to Cholera Outbreak in Kubwa, which is currently the epic center in the FCT, the Federal Ministry of Environment, in collaboration with relevant stakeholders, including environmental health officers in the states and local government areas, has commenced nationwide intervention response covering the following areas. That is response activities covering the following areas: sanitary inspection of premises, environmental surveillance of hotspot communities, treatment of contaminated water sources and sites, strengthening the capacity of environmental health officers in the state ministries of environment and the affected local government areas.
I'm delighted to have you all present in my community, among all the local government in Nigeria and the area council in the FCT.
Residents of Bazango community express certainty that cholera can be a thing of the past if the government yields to their plea. Chinaza Samuel, Arise News.
Well, still in the studio with us is Dr. Tuyi Mebawondu. He's a public health physician and the Chief Executive Officer of Medway Health Limited. Now, you heard in that video, which we were just discussing right before we played that video, the issue of no availability of toilets. I mean, what's really going on?
Well, I think first and foremost, most of this work should fall within the purview of the local governments. They must be able to look at the streets, look at the parks, look at everywhere, and be able to actually find a way to design a simple toilet that people can actually use. They should be able to examine homes and look at it, whether the toilet is, the waste is being disposed into the gutter or properly disposed. This is within the purview of the local government. But with the collapse of the local government system, this is what we're getting. And look at, the politics of cholera is there. For me, these are fundamental things because cholera is a demographic and socioeconomic issue in a way that the vulnerability index is mainly poor people, or it's mainly slum dwellers, and of course, rural dwellers. These are people that are suffering from, cholera essentially. And when you look at malnutrition as a driver of cholera, Nigeria, we're number 2 in malnutrition in the world, especially child malnutrition. 34% malnourished, and as much as 2 million severely malnourished children. Now it's going to get worse because, number one, the food security is critically challenged. And you are seeing, when you look at IDPs and cholera, because when you see instability in the country, what you see clearly is cholera. But what we should have done essentially is to be able to think ahead and do something about water supply, sanitation, and hygiene. But what Nigeria does every time is to throw fire at it. Emergency operation centers.
Fire brigade.
Yeah, cholera is coming, everybody starts running here and there. 50 years, since 50 years, when the cholera showed itself, in Nigeria, we're still battling with cholera at this stage. What kind of development do we have? And for someone, this thing bothers me a lot. You know why? We have how many universities in this country? We're graduating doctors. We're graduating engineers. We have those people that choose to be brilliant in a way. They cannot connect to solve the fundamental problem of the nation. Okay? Yes, doctors can go away because those people seeking care are also going away. They're not going to meet them there. But we should be able to connect. We have engineers, sanitation engineers. They should be able to connect and design a simple toilet for us to use, But we're not connecting. And that is, once your education cannot connect to your country to solve problems, we have problems in the Northeast. We have problems of banditry and co. But our education is not connecting to solve those things. And of course, we'll be underdeveloped perpetually.
More than 2,000 people dead between January and this time.
58,000 cases.
Cases already.
Yes.
At a time that our health facilities are struggling with COVID, with strikes, by the resident doctors, how do you think we'll be able to see this through? I mean, the rains are still there. We'll still have a month or two, or they're about to go. Are we going to fold our hands and witness more deaths?
Education, health education. Because when you look at some of these things, you must be able to look at what is doable. What is doable in this regard? I am expecting that each local government should be able to step up education about water, sanitation, and hygiene to individuals. Apart from that, Nigeria must be able to take action to ensure that they protect themselves. Don't be in a hurry to die. Don't worry, you stay forever underground. Don't be in a hurry. Just stay on top of this guy for that. Please take action. Yeah. But of course, you see people even on the bridges and everywhere because there are no public toilet facilities.
Even in Lagos.
Even in
Abuja.
At what point will this even be described as a national emergency? You just made all those valid points.
Absolutely.
Raining season,
Yes.
COVID-19.
Yes.
All of these are going to hinder us. It's 2,000 deaths. And while I was reading, I saw that Bauchi State recorded the highest number of suspected cases. Why is that?
Again, because obviously what we have mentioned, malnutrition is a driver, okay? Inequality is a driver. Poor water supply is a driver. Poor hygiene and sanitation. These are the things. And then when you see a government disconnect, you can use one single case of a disease, of an epidemic, to measure how government is working. You pick cholera, it tells you a lot about what is happening in the government. Absolutely. It tells you a lot about the thinking going on in that government. Okay? So when you see somebody who is supposed to represent over a state, and you are seeing a embarrassing repeat of cholera, preventable, treatable, simple disease, water, sanitation, hygiene, education. Simple, that's all.
A lot of people will even say, what's NCDC doing?
Yes.
I mean, if it's
they are creating emergency operation centers. What is the meaning of that? COVID emergency operation center, cholera emergency operation center, Lassa Fever emergency operation center. We're not designed to serious issues. Let us honestly, because the health system is broken. You cannot define your civilization. You cannot define your development when you don't have health system.
Yes.
Your civilization will break down. You look like a pastor. I'm sure you read Bible. What happened? It was health that led to the destruction of Egypt. When health epidemic visited them, the leader of Egypt had to let go.
The plagues.
Yes. Yeah. It was health. Health is so critical. Even if you are not healthy, you can't do anything. You saw what health did to us during the regime of some government here. Yes. When our president was sick and had to be, packaged somewhere abroad. Let us be serious. But again, as it is now, my own advice is simply this. Individual, guys, take charge of your health. Do something. Don't be careless.
All right, so for the benefit of our viewers, if you can break down the steps, the preventative steps for this cholera disease, how they can prevent it, and what the symptoms really are so that people can be aware.
Okay, simple. Cholera is a disease it's caused by bacteria, okay, very, very fatal bacteria. It causes vomiting and stooling, okay? You usually pick the cholera either from a contaminated water, contaminated fruits, contaminated food, or contaminated hand. Okay? So that is how you pick cholera. So your attitude simply is this. Okay, the incubation period is a few hours to about 5 days before you start seeing symptoms. And of course, the general constitutional symptoms followed by the vomiting, stooling. The stool is watery. Watery.
That's diarrhea.
Diarrhea like rice water. Diarrhea. It's just like rice water stool. Just, come like that. Pouring out, you lose electrolytes. I see lots of the electrolytes are actually, leads to death. Okay, and fluid. So what are you supposed to do? First and foremost, your source of water supply must be tidy sufficiently. If you don't have, of course, I know that you don't have good water supply or pipe water. At least get your water, keep it in a clean container. If it's water guard, put inside it so that you can have some disinfection. At least cleansing of the water. Then always use this one cup to take water from that your source I'm talking to our people in rural areas and perhaps the slum dwellers, who may not have the benefit of the. So use that. Then every time you need to put anything in your mouth, wash your hand. Make it a habit that whenever you need to approach food or food table, wash your hand. When you go out and you're coming back, wash your hand. Hand washing is key. We should have allowed that to be part and parcel of living of children, in primary school.
Right.
In primary school. So wash your hand. But again, unfortunately, there's not even water to wash hand. Right. Sanitizer is expensive.
And then the water itself, how do you keep it safe? This idea of boiling water and keeping all of that, does that help?
You know why it's not sustainable? Right. Gas to boil the water, firewood to boil the water, it's become, if you can do it nice, if you can boil your water, very good. But if you don't have, it comes to boil water, water guard is very cheap. You can put quantity inside your bucket of water and drink your water. And then, make sure that your environment is kept clean. Try to clean your environment within your power, And then when you see cases of people discharging waste into the gutter, into the environment, please call government. We hope they are going to respond. So it's up to you. And then it is important for everybody to have a number of a health worker that you can always touch. There are key things. I know that police number should be of military. If you have a friend, police, military, and
emergency numbers.
You must generally be able to have a number you're going to call. Yes. This is my condition, okay?
Because just like you said, within hours,
you can lose so much water, and then you can.
Because it's so funny, Bangladesh used to be one of the worst hit when it comes to cholera.
Those days, yes.
In those days. And it looks like Bangladesh has conquered.
Especially during the monsoon season. I was in Bangladesh to do some of my studies in those days. Okay. India, Bangladesh were just really terrible countries. How can we overtake India? My brother, I'm sure you have been there. With their population and the level of death. How can Nigeria, the population, 1.3 billion. And then times
poverty capital of the world?
Yes. How do you know poverty capital of the world, cholera capital of the world, malnutrition capital of the world, all sort of negative first we're picking. So when you see cholera, it tells you a lot about the government. You don't need to bother yourself. Right. You can understand their focus on hygiene, on water,
on sanitation. What did Bangladesh do right that we're not doing?
Water supply, education, sanitation, hygiene. It's so basic.
Yeah, it does appear that water is key, really.
Lagos State has the water supply of Lagos State. Sorry, not Lagos State, Nigeria. Surface water supply is as much as 490-something cubic kilometer. Yes. South Africa is just 49. It's not that we have such water has become a scarce commodity in the world now that our own is just being frittered away and neglected. You go around Lagos, you see all sorts of things floating on the water, all sorts of things floating on the water. Absolutely. These are embarrassing things. How we can get to the level of that numbness and not connecting to our environment. You mess up your environment, the environment throws it back at you. Jam mutates in that kind of environment. And then when it jumps to you, you say that it's demon. So again, you have to face the demon. But I want to appeal to individuals, please, 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 take charge of your health. The little things you can do.
Right.
The big ones, maybe you can use prayer to support those ones. But the little you can do, please do. Right. Wash your hand, drink clean water, keep your environment clean and safe, please.
Well, let's talk about treatment options. There's also the issue of misdiagnosis. I mean, cholera does appear to be somewhat like
typhoid, isn't it?
Typhoid. So how do we deal with that?
Are they related in a way?
Yes, they are all waterborne diseases, essentially, okay? And sanitation and hygiene problem, essentially. Now, the critical things, the differentiation should happen, should be done by a health worker. When you try to give so much information to the public, everybody tends to be a doctor in a way. I know what. But I don't want to encourage that. Now, the thing is that the stooling in cholera is frequent with vomiting. In fact, in Yoruba they call it arunigba meji. That means you have to put a bucket here and put a bucket here. So to take. So, and it's frequent and it's more, fatal. It's more fatal, but the quality of the stool, one is rice water, one can be like a different color in a way, like a bean soup, okay? The fever is higher in typhoid and it has a pattern, what we call a stepladder fever. But those ones are not even the thing we should focus on. Now, when you find out that a child is stooling and vomiting, please, ORS is your oral rehydration solution. So you can easily boil the water, if you don't, and cool the water, and put little salt, salt 1 level, sugar 10 level, tiny spoon, and put and mix in a bottle, like 2 bottles of Coke, and then drink. But the salt is being sold outside. You can mix, just drink water. Drink water, you will get some.
No vaccine for it?
There is vaccine. Okay, now, what I was expecting is that IDPs in the Northeast, quite a large number, it's spreading everywhere now. I expect that when you are setting up the camp, it is essential that you, first of all, do, the vaccine, the oral vaccine for cholera.
Yeah, you inoculate them.
Yeah, you just put it there, especially the vulnerables. Who are these vulnerables? Children, and elderly. These are the vulnerables. Yeah. You do those vaccinations. You are pushing this vaccination. You are pushing this vaccination, and then structure a water supply system for them.
Yes,
but we shouldn't have IDP anyway.
Exactly.
We shouldn't have IDP anyway. Yeah. The more we see fragility of a state, the more we see diseases. Diseases accompany instability. The major challenge is the politics of health itself, the politics of cholera, the politics of COVID, the politics of even human resources for health.
Well,
if we don't address the politics of health, the policy of health will suffer perpetually.
Dr. Tuyi,
thank you.
You have been fantastic. This has been quite an informative session. Thank you for joining us on The Morning Show.
My pleasure always.
Thank you.